This study shows that validated allergen exposure chamber is a plausible tool for assessment of house dust mite triggered allergic rhinitis. Although allergen exposure chambers offer stable levels of airborne allergens, the validation of symptoms and other endpoints induced by allergen challenge is key for the recommendation as a useful tool for the assessment of patients, especially in clinical research. This study aimed to demonstrate the reproducibility of defined clinical endpoints after allergen exposure chamber house dust mite challenge under optimal conditions in patients with allergic rhinitis. The assessment was first subjective, performed by the patients by measurements of total nasal symptom score, visual analog scale assessment VAS, and objective by the investigator, acoustic rhinometry, peak nasal inspiratory flow, and nasal secretion weight measurements. Safety was assessed clinically and by peak expiratory flow and lung function. The concentration of house dust mite on average remained stable within the tested allergen concentrations. Most symptoms were observed at the concentrations of 3,000 particles per cubic meter or higher. The symptom severity and other endpoints results were reproducible. 5,000 particles per cubic meter and the challenge duration of 120 minutes were found optimal. The procedure was safe with no lung function abnormalities due to challenge. In conclusion, house dust mite challenge in Almed allergen exposure chamber offers a safe and reliable method for inducing symptoms in allergic rhinitis patients for the use in controlled clinical studies, including allergen immunotherapy. Thank you for your attention.